Let's play the filling game. What's in your filling? Composite? Amalgam? Ceramic? There's lots of options that modern day dentists have to fill the tooth. But let's start with the beginning. Why is it necessary to do a filling?
Down in Brookhaven, with a smile shining bright, Dr. Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
In dentistry, when we find decay on a tooth, that means that there's an unhealthy area of the tooth that's broken down, and we need to remove that unhealthy tooth. The problem is that leaves us with a small hole or a defect in the tooth, and if we leave it exposed like that, it's going to break down further and cause pain and issues. So we have to fill that hole and restore the tooth to its natural shape and size. So an analogy I like to use is, let's say you lost the tip of your finger. There's a lot of options for restoring that finger, but we want to make something that looks and feels just like your finger was before you lost the tip. The tooth is the same way. When you have a hole or a defect in the tooth, our goal is to fill that hole and get that tooth feeling and looking almost exactly as it was before whatever caused that hole to develop. The options that we have for restoring missing tooth material, originally we only had amalgam, which is the silver filling. It's gotten a bad rap because it has some innate mercury in it. For those of you that are concerned about mercury, that's a valid concern, and you should know that we really don't use amalgam in the United States very often anymore. In fact, it's even outlawed in parts of Europe. In our practice, we don't use amalgam anymore. And one of the main reasons is because it's darker, it can be less aesthetic, and actually you have to take away a little bit more tooth structure because it's actually just forced into place to maintain that filling. We use composite resin, which basically gives us the opportunity to match the color and the appearance of the adjacent tooth and all the area in there. Our goal when we do a tooth colored filling is to basically have it blend right into the mouth and be invisible, so the shade matches, it feels the same to your tongue, it supports the tooth, so when you bite and chew and function, you don't even realize that the filling's there. The other option we have is a porcelain or ceramic inlay or onlay. And I don't want to get too specific, but that's basically where we build something outside of your mouth and bond it in to specifically fit the space in your mouth, almost like a jigsaw puzzle. One of the advantages of those is it's very strong, but again, it's aesthetic. It looks just like a tooth colored filling. Composite resins are great, and we use them a lot in our practice. The only downside that we have with composite resins is that the filling is really large. You sometimes reach a point where you have more filling than tooth structure, and that kind of leaves the tooth in a vulnerable state, because while the filling does a good job of holding together the tooth and filling those gaps, a lot of times it can create almost like a wedging effect. So if you have a big tooth with this really big filling, the concern is that part of that tooth might break off in the future because there's not enough healthy tooth to hold that really big filling. And at that point, it's definitely more beneficial for the tooth to have a crown, because what a crown does, it goes over the top of the tooth and holds it all together and really protects it from breaking down. So if you're wondering the strength differences in these, your natural tooth is really strong. In fact, enamel, which is the outer surface of your teeth, is the hardest material in your body. It's even stronger than bone. But when you start to have a decavity or a filling and you take away some of that enamel, the intactness of the whole tooth is kind of compromised and the tooth is a little bit weakened, to the point where if it gets to be a big enough filling, we need to protect that tooth with a crown. So if you're interested in a practice that's amalgam free, and we'll actually sit down with you and discuss what your options are, what our materials are, we're an open book. I love to share with you. One of my favorite things is an informed patient, an educated patient. I think you make better decisions, and I think you're more comfortable with everything that we do here. So if you have questions about needing a filling or existing fillings, give us a call. We'd love to meet you and help take a look and tell you what's best for your mouth. I'm Dr. Langston. I'm a prosthodontist and the owner of Dental Implant Aesthetic Specialists here in Brookhaven, Georgia, and I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.